I wanted to, I have the great opportunity to actually now speak for about 10 minutes and tell you a little bit about what we're doing at Mental Health Research Canada on the workplace mental health file. We do not create resources. We are more than happy to share the resources of others. We do think that collaboration is the best way forward here. And so what we're going to show you today is not actual resources, but some of the data we've been collecting around workplace mental health, all of which has been collected since the start of COVID. And most of this data is actually freely available to the research community. And we've developed some with Health Canada, some with Canada Life, and we're happy to show you a little bit of it today. I'll give you a snapshot. I could easily fill a whole day talking about this research. It's so in-depth, but nobody wants to hear that. I'm going to ask my colleague, Brittany and Sarah, to keep an eye on the chat. If there are specific questions and comments, I'll try and leave a minute or two at the end to cover it off, but I'll get started. So the first, I want to talk to you about 3 research projects we've been doing. The first is the Psychologically Safe Leaders Assessment. We did this one in partnership with Marianne from Workplace Strategies and Canada Life. And on this particular one, we looked at 1,200 leaders and whether they felt they were supporting the mental health of their workers. The second one is a report we just released last week, which looked at 5,550 or so employed Canadians across the country and 13 psychosocial factors which are impacting mental health as part of the Guarding Minds evaluation, which I know many people have mentioned here. We also looked at burnout and a few other issues. And the third study I want to mention very briefly here today is the ongoing work we're collecting, tracking mental health of Canadians. We're well over 30,000 respondents on that. It started in April 2020 and will continue for the indefinite future. And from that, we've been able to extract the information about the employed Canadians within it and been able to do some analysis looking at pre and post levels of mental health on anxiety and depression specifically. I'll get into it. And Sarah, Brittany, if there's a burning question that does pop up, by all means, interrupt me. So the Psychologically Safe Leaders Assessment, as I mentioned, was an evaluation of 1,200 leaders. Was not particularly surprising, but leaders give themselves very high scores for their belief in terms of how they're supporting their teams. We did note there were some differences in demographics. Older leaders and women tend to rate themselves higher at supporting the mental health of their employees. We did also look at remote, in-person, hybrid. We do know that leaders are saying that it is harder to manage teams now. And interestingly enough, those working on site are more likely to say their leadership roles have gotten harder. What's fascinating about that from my perspective is that a lot of those on-site employees are in critical services that are deeply affected by COVID-19. So nurses, teachers, retail workers, trucking, transportation, and those sorts of sectors which are in person and they are particularly challenged leaders right now. We did look at what areas they felt they were strongest. Leaders felt, again, they were very high across the board on a number of factors. The ones that were strongest were being accessible to employees, responding promptly to concerns, keeping employees informed, support work-life harmony, and recognize the impact of harassment. A lot of leaders were saying they were struggling more with emotional reactions, monitoring employee goals, offering one-to-one meetings, fostering a sense of purpose, and provide opportunities for growth and monitoring those the workload. Those were the areas they were saying they were struggling. Moving on, the psychological health. Oh, sorry, before I move on, actually, can someone put into the chat, I put it at the bottom here as well at the end of the presentation, the list of that report is a comprehensive report. If you're interested in learning about leaders, I would advise you to take a look. But moving on to the psychological health and safety study, this was a massive study with, as I said, over 5,500 employed Canadians. We did look at it by sector, by age, by ethnicity, visible minority status, by demographics, such as LGBTQ2S, people who might have some sort of mood disorder, and a number of other factors, unionized small business. There were so many demographic factors that looked into this. It is an incredibly comprehensive study. And again, what we found was there were demographic indicators like being LGBTQ2S+, having a mood disorder, and some ethnicities, not all ethnicities, were indicating that they were struggling with mental health in the workplace. We did look at other factors. We did note that unionized roles indicated higher negativity around workplace mental health. Those working from home were indicating more negative mental health in this particular study. And we also noted that visible minority and non-managed were other factors we studied as well. Transportation, interestingly enough, was actually the poorest scoring sector that we looked at. We sort of assumed it was going to be healthcare workers or public safety personnel, first responders, but it was actually transportation that came out as having a particularly difficulties with toxic work relationships, poor communication, et cetera, et cetera. While we did note on first responders and healthcare workers, other challenges, not being able to communicate with bosses, unreasonable workloads were other particularly challenging areas as well. Shockingly, 2/3 of nurses were actually indicating burnout. Mental health care workers were almost at that level as well, at 61% of them indicating burnout as well, which was really challenging. These were the 13 psychosocial factors that impacted workplace mental health, and this is the percentage of employed Canadians who indicated they were seeing this on a regular basis at their workplace. This was the burnout slide we put together in terms of what percentage of these Canadians were actually indicating burnout. As I said, 66% of nurses, 61% of healthcare workers. Many people with mental health issues or previous diagnosis indicated that they were burned out as well. You can also see massive differences in burnout by age, which was another interesting thing we found. Again, all of this is freely available. I don't expect people to read this slide in full, but these were the 13 psychosocial factors. And we did study how each one of those factors was going across all of these demographics, region, and industry. We collected over 30 industries. We highlight 7 here. We are working with a number of other industry associations and groups to analyze the remaining 20+ industries to provide those scores. And underneath each and every one of those 13 psychosocial factors are 5, 6, 7 questions, which make up that composite index score. So this would be, for example, the questions that make up the engagement score. In closing, I want to talk about our Health Canada project. This is massive. Again, this tracks, and we report on this regularly in terms of the number of Canadians who are reporting anxiety and depression, anything from a Kessler psychological distress scale to PHQ-9 or GAD-7, which are screener tools. We have found that about 24-25% of Canadians are indicating anxiety. About 15% of Canadians indicated burnout. That's from data that was collected in December of 2021. Obviously, that was the onset of Omicron, but we hadn't had lockdowns yet, so we're anxious to get more information around that. We did find that about 20% of Canadians are accessing mental health resources and 13% are not accessing resources, but should be, which is certainly something we're keeping an eye on. And we're also watching a large contingent of Canadians who are starting to access services virtually. One of the things my colleagues worked on was a massive analysis of all of this data by workplace. So we did look at all the workplace indicators we had in that data. And as I said, it's a huge, massive data set. And we really wanted to answer the question, who has been most affected in the workplace by COVID-19 in their mental health? The question became challenging because we really wanted to look at it from 3 different angles. One, whose mental health got progressively worse as a result of COVID? Whose mental health was bad as we started in COVID, but then got worse even in a marginal way. And we also wanted to see what did diagnosis, pre-existing diagnosis look like compared to new diagnosis since COVID. And then it got even more complex when we got into it, because what we realized is that there were groups of individuals in each sector that there might be a number of people who were, for example, in the postal service or in delivering things who had very high anxiety scores, but there might be another group who didn't. So we saw what we would call a bimodal distribution, which would be a different groups at different levels inside those sectors. So we went about trying to actually map it, which is what this is here. When we look at each and every employment sector, and for example, in education, elementary and secondary, which is the 7th over. That's a bimodal distribution. There were a lot of people in education who would rate themselves as a 3 or a 5 in education. And then post-COVID, what you see there is a lot of people at that 7-8 category. So that bimodal distribution has disappeared. And what that tells us is that everyone, even the people who had low anxiety pre-COVID and the people who had mid-level anxiety, they're all now at around the same level. So this was why it was important for us to map it. And we mapped it across all employment sectors. And again, this is self-rated depression mapped against every employee sector. Pre was the orange, blue is the current. And we also mapped the number of new diagnoses by sector. So for example, 18.4% of healthcare with COVID-19 patients had a diagnosis pre-COVID, and an additional 11.5% had a diagnosis since COVID. Interestingly enough, janitorial and maintenance services had a massive number of anxiety disorders diagnoses pre-COVID at 23%, but they only went up by 4.1%. So when we were trying to frame out this question, we were saying who's struggling the most. It really was a question of who's struggling the most now, who was struggling the most before, and so we wanted to map it this way. And this is the diagnosis of depression as well. So again, this is freely available on our website. It's a rather technical document, but we are looking to communicate this in a more public-facing way in the near future as we get to it. But I appreciate it's an important piece of work. These are the links to where you can actually find these documents today. And as some of you may know, we've been presenting on these over and over and over again. We do a lot of presentations on these. And I know we've just covered it in brief here, but if you have questions, please reach out. And then, yeah, if I can take maybe 2 minutes to take questions. This is my email. This is my colleague Brittany's email. We both work on this data on an everyday basis. And what we really also wanted to share is if someone wants the data and they have data research capacity, we are actually able to share this data responsibly as well too, in sort of an open science perspective.